So if anybody has ever had a consultation with myself or Mon or even doctor, you'll probably have already heard this, but I'm going to talk you through how I do a consultation for muscle relaxants, so anti-wrinkle treatments, and hopefully you guys can learn a lot from this. It's my spiel or my explanation that I give everybody, so hopefully it answers all of your questions. So first off, I like to explain to all of my patients how the treatment works, how the medication works as well. So that way, hopefully if they work with us for a while, or if they're my patient for an ongoing time, they understand what to expect. And I feel as though when I educate my patients, they understand. For example, if their wrinkles don't go away from one treatment, which most of the time they don't, they understand that and their expectations are set. So I use my handy face, sorry Mon, and I describe how the muscles in the face work first on this. So as we can see, these are all of the muscles in the face that are responsible for our movement. So when our muscles contract and move quite rapidly, everything that gets pulled along with it. So the muscle is underneath, and then we have like the fat pads and the skin, and it all gets pulled and creased at the same time. So wrinkles and static wrinkles are really caused by a muscular problem. So we have to understand that's the most important thing. The first group of muscles lives between our eyebrows, here. And it's a group of muscles made up of the procerus, which is the one in the middle, the corrugators, which are on the sides, and then a part of the frontalis, which comes up from here. So it's this group of muscles that works together to pull your brows together and down, and they leave you with this mark, the number 11 mark. So I generally get them to try it on themselves now, and I get them to go angry. So you can see my corrugator here, my procerus, and then part of my frontalis at play here. So I've been treated, it hasn't fully worn off or anything, so you can still see I have some movement to show the patient, but I show them on themselves. So go ahead and go angry, and you can see the number 11 that I refer to. So that's the first group of muscles that I like to treat, and it's called the glabella. The reason I like to treat this one if you need it is because you don't look any different after treatment, and it really prevents that line from getting deeper. Then we move on to the next one, which is the frontalis muscle. So this muscle holds up your eyebrows. So when you push up your eyebrows, you get these small lines here, which you can see on me. So I draw them like this. The wrinkles are perpendicular to the muscle fibers. So the muscle fibers go up, the wrinkles become perpendicular. It's with this muscle that I like to create a brow lift. So as you can see with my brow sitting quite high, and the way I achieve this is by injecting in a V-shaped pattern. So I knock out the middle part of the muscle. I put no product here and no product here. What this does is it creates this part of the muscle, and it helps it stay active to pull up on your brow and give you a lift. After a week or two, when you come back for your review, I have a look at it and we ask, are you happy with it? Do you like where your brows sit? If it's too high, then I can reverse it and put a little droplet here, and it just brings the brow back down. So as you can see, they're two separate muscles, so nobody is 100% even and symmetrical, which is normal. We're not aiming for that. Everybody is different, and you really have to look at the muscle movement for each patient to determine the best course of action and the best injecting pattern for that person. And then we come down to this muscle, which is called the orbicularis oculi muscle. It sits around your eyes, and with contraction, again, you get the crow's feet. So this muscle I don't generally like to over-treat, because it's when you over-treat this muscle, you can look fake or insincere if you're smiling and nothing is moving. So I generally inject quite lightly around here and relax a portion of that muscle. Also, to increase the brow lift, I engage the top part of the orbicularis oculi muscle to relax it, plus the addition of my pattern up here to give a nice lift. So it's not as easy as, oh, just come and get muscle relaxant and it's all going to be the same. It's really up to the clinician to have a look at the muscles, the strength of the muscles, and determine the best way of moving forward. And that comes down to dosage, it comes down to pattern of technique, it comes down to knowing that person's history. So I really like to create a history with my patients. As if any of you guys are watching, you'll know that. I know exactly this brow goes up, that one's a bit dodgy. You guys, I'll learn that with time. And also I bring you back for a review to always ask and check. So I know my dosage was correct, my pattern of injecting was correct, the outcome is what I predicted, and we take it from there. So that's why I invest a little bit at the beginning, doing this exercise, showing the patients on themselves and with my dummy, so that they understand what they're in for, hopefully long term if we keep treating together. Then I move on to product choice. So we have in Australia, the TGA has allowed us to use 3 brands. I will show you them. So in our clinic, we use all 3. The reason I like to stock all 3 and use all 3 is because if you've been having treatments with us for years, so Mon and I have both been injecting for a long time. So if you've been being treated with us from the beginning, I would like to switch you through the 3 brands so that you don't develop a tolerance, to either one. If I just use one your whole life, chances are your body's gonna get used to it and it will stop being effective. So every now and then, it's up to us to change the brand up so that your body doesn't recognize it and it stops being effective. So also I like to take into consideration people's history. So if they're new to me but they're not new to this treatment, I ask them, what have you used before? And the number of people that don't know what products they're using is actually surprising. I always show the patient, this is what I'm going to use today, this is what I'm going to use next time. You have to know what's happening. And then if they tell me brand X worked well for me, brand Y didn't, I take that on board, but also did brand Y not work well because the dosage was incorrect? So it's really, again, back to the history and that medical history that I'm creating with you to know that this brand gives you 3.5 months, this brand gives you 4 months, whatever it is, and we have to learn. So really, it's best, even if it's not with us, it's best to stick with one injector if you can, because that history is really important. So the difference amongst the brands, 2 of them are bigger boys, they're bigger units. So the number, don't worry too much about the numbers, they're not really equivalent. For 2 brands, they are the same and they're bigger molecules. They can take up to 2 weeks to kick in. For the other brand, it is a smaller molecule and you can see the result in 3 to 5 days. My average clientele, 95% of my clients, regardless of what brand we use, it lasts 3 to 4 months. 2.5% of my clients, regardless of what brand we use, last 6 weeks. 2.5% of my clients, regardless what brand we use, last 8 months. They're my really lucky clients, and it's not average and it's not normal by any means. If you're getting 3 to 4 months out of your muscle relaxant, you're winning. That's good. So, like I said, it's important for us to shift through the brands every 3 or 4 treatments to reduce the risk of a tolerance. And then I move on to explaining to them with my little drawing, which I'll draw for you guys now. Next one. So I draw a graph and then I draw this. So what I explain is, regardless of the brand, the muscle relaxant here in this section takes about 2 weeks and it's the strongest. And then after 2 weeks, your muscle relaxant slowly starts to soften and your movement comes back quite slowly at this point. As you can see, it's starting to come back. So this is your movement coming back. This here is when your movement is back 100% and you're back to your baseline. What I tell my clients is, I want to see you at this point. So at this point, your movement isn't back 100% and it's not still quite fresh and frozen. So this is the sweet spot where I want to bring you back and treat you again. I want to do this so that I build on your results from last time. If you have quite deep lines, they're not going to go from one session. They'll get better and better with each session. So I need you to come back at this point for your 2nd and 3rd treatment so that you get the best results and we're building from last time. If you come here, it just means that you've undone the foundation that we've already set with previous treatments. And then I tell my clients at this time frame, so from your first, when you have your treatment to when I want to see you again, like I said, the average is 3 to 4 months before the sweet spot comes up. So some people, this happens really quickly, like I said, in 6 weeks. And for some people, this happens in a longer time and that can be over 8 months. But the average is 3 to 4 months. Thanks, one. The other thing that I explain to my patients is the way a muscle relaxant works. So a muscle relaxant, what it does is it goes into the muscle and it blocks the release of a neurotransmitter called acetylcholine. So acetylcholine is a neurotransmitter, which means a chemical, which is released at the nerve endings. Once this is released, it causes the muscle to contract. So these medicines block the release of the acetylcholine at the nerve ending. That's how it works. The actual medication is removed from your system within 24 to 48 hours, and the effects of that medication last 3 to 4 months. And in that time, your body, because it's smart and it's intelligent, it helps to encourage the release of acetylcholine. And that is that determines the duration of your muscle relaxant, and then you can treat again. So you don't walk around with the muscle relaxant still in your face. I've had my treatment maybe 3 months ago. It's not still there. It's the effects of the medication that lasts that long. So generally, that's my spiel. I hope you guys learned a lot from it. And if you have any questions, come in and you can hear in person, or just ask me and hopefully I can make it clearer for you. But taking the time to really explain it is only going to help you long term. So I hope you learned a lot.